So today we're going to be talking about Foster-Kennedy, and we're going to be talking about types. You can watch the other video, which is about differentiating Foster-Kennedy syndrome from pseudo-Foster-Kennedy syndrome. In the type 1 Foster-Kennedy syndrome, it's increased intracranial pressure, which causes papilledema, but in only one eye, and the other eye has optic atrophy. So the one eye has a compressive optic neuropathy because something's pressing on the optic nerve, and the other eye has papilledema because of increased intracranial pressure. This is the classic type 1 Foster-Kennedy syndrome. However, sometimes we have a type 2, and then type 2 we have bilateral papilledema, but we also have the compressive optic neuropathy, which is optic atrophy in one eye. So we got a unilateral optic atrophy plus a bilateral papilledema in a type 2 Foster-Kennedy syndrome. And in a type 3, you have bilateral papilledema and then bilateral optic atrophy. So it's basically the same process though. And so the normal things that cause the Foster-Kennedy syndrome are large lesions in the anterior fossa. So a large lesion like olfactory groove, or frontal lobe, or sphenoid wing meningioma, where you have one side pressing on one optic nerve causing the compressive optic neuropathy, but because the lesion is so big, it causes increased intracranial pressure and papilledema. This is different than the pseudo-Foster-Kennedy, which is a sequential optic neuropathy. Optic disc edema in one eye from acute NAION, and last year they had NAION in their other eye, but now it's optic atrophy. So you need to be able to differentiate the true Foster-Kennedy from the pseudo-Foster-Kennedy and know that there are different types. The most common, papilledema in one eye, optic atrophy in the fellow eye, usually from frontal lobe, olfactory, or sphenoid wing meningioma, a large lesion pressing on one optic nerve and leading to increased ICP. But then you've got bilateral with a unilateral optic atrophy, a type 2, and a bilateral optic atrophy and a bilateral disc edema, a type 3 Foster-Kennedy syndrome.